So, can you introduce yourself and describe your path to becoming a clinical psychologist?
Yeah, I'm Simon Rego. I am right now Chief of Psychology at Montefiore Medical Center, which is a hospital system in the Bronx, New York. I'm a professor of psychiatry and behavioral sciences at Albert Einstein College of Medicine, which is the medical school affiliated with Montefiore Medical Center here in the Bronx. Uh, My path to clinical psychology, what got me into the field in the first place is a long story. I'll try to make it short. Well, the pragmatics of it are that I did an undergraduate degree, a Bachelor of Science in psychology at a Canadian university in Kingston, Ontario, Canada, called Queen's University. And as part of my Bachelor of Science honors degree in psychology, I did an honors thesis in my fourth year looking at eyewitness identification accuracy across races. Um, and that led me, since I was in the field of forensic psychology, led me to a master's degree program at John Jay College of Criminal Justice in Manhattan, where I did a master's in forensic psychology. And then I went back to Canada and I was working as a consultant for a institute called at the time it was called the Clark Institute. Now it's the Center for Addiction and Mental Health in their forensic division, and at a prison, a medium security prison in central Ontario called Warkworth. I hit a ceiling there where my advisor said, you really should go back and get a doctoral degree. And there weren't any doctoral degrees or many in forensic psychology at the time. So I went and did a clinical psychology, PsyD, at Rutgers University's Graduate School of Applied and Professional Psychology in Piscataway, New Jersey. And that's the short version. As part of your doctoral degree, you're required to do a full year internship at the end.
Oh,
Uh, and so I did my internship year at a hospital in Vancouver, Canada, called University of British Columbia Hospital. And after finishing my internship, I went on to do a 2-year postdoctoral fellowship at a place called the Center for Treatment and Study of Anxiety at the University of Pennsylvania in Philadelphia, Pennsylvania, and then came up to Montefiore right after that in 2003, and have been here pretty much ever since for the last 22 years.
nice. So, how long was the total training?
The total training, if you count from when I started at Queen's, just in educational years, there was 4 years for my Bachelor of Science honors degree. And then I did my master's in forensic psychology in about a year and a half. And then I did my doctoral degree at Rutgers in another 5. So that's like 10 and a half. And then I did a 2-year postdoctoral fellowship at the Center for Treatment and Study of Anxiety. So that's like 12 and a half
Wow.
years. Although the 1.5 years at John Jay College of Criminal Justice, in the end, they counted because they helped get me where I am, but I'm not into forensic psychology anymore. So you could argue, although I wouldn't, that some might say, well, that was a waste of time. You didn't need that year and a half to get your master's in forensic psychology. But at the time, I didn't know which direction exactly I was going in. So, and it was important. And it also helped me, I think, become more competitive applicant to getting into a doctoral program. So maybe you could take a year and a half away from my total and trim it down. But that's pretty much the course for a lot of people who get a doctoral degree in clinical psychology.
Okay. So, what does a day in the life look like for you now, and how has it changed from the past?
Uh, a day in the life now is every day is a little bit different. It's a mixture of being chief of psychology now, a lot of my days are filled with administrative meetings. Like I just came out of a central administrative leadership meeting where we there's several leaders in the department that um, review topics of importance to the rest of our department and create strategic plans on how we will implement them or discuss them with the relevant teams in the department, hiring new programs, reacting to the current administration and how how that impacts our services we're delivering, things like that.
Okay.
And then I have a meeting with you. So then I meet sometimes with people who are just curious about psychology or the field. They get sprinkled in every now and then. Or I might think of them like mentorship meetings with people in different stages. And then later today, I have a couple of patient visits. I
Oh,
do, I do some supervision with our trainees who are trying to learn about how to do psychotherapy. And then I have a couple of calls to make for administrative purposes, updates on with particular people on projects we're working on. And that's generally the mix. Some days I do a little bit of teaching. If there's a didactics day, a lecture day for some of our trainees. But for the most part, it's a mixture of these sort of meetings and supervisions, a little bit of clinical work, things like that.
okay. So, like in the past, did you work more with patients? Was that time more with patients?
Good follow up. Yes. So how's it changed? When I got here 22 years ago, actually my first job here for the first year in 2003 to 2004 was all research. I right out of my postdoc at University of Pennsylvania, I came to join a center here called the ADC, the Anxiety and Depression Clinic, with a psychiatrist who was just running a variety of clinical trials looking at different treatments for anxiety and depressive disorders. And I just assisted him on research coordination and clinical coordination for his research studies he was doing. And I did a very little bit of supervision of psychology interns at that time. And then after a year, I moved into our adult outpatient psychiatry division clinic. And my week became almost entirely seeing patients
Mm-hmm.
with a little sprinkle of teaching and supervision and team meetings and things like that. But mostly it was clinical for 4 years there. Then I left that, and for about a year and a half, I joined our department, had founded a health maintenance organization or HMO that was responsible for the mental health needs for about 200,000 people here in the Bronx. And they were looking at efficiencies in how they operate and how to best help this large population we were trying to manage to, to optimize their health and minimize their cost on our system. So I did a lot of network analyses and things for that uh, health maintenance organization for about a year and a half before then coming back to take over for psychology training, where I was running our psychology internship training program, and we created a postdoctoral fellowship program of our own, and then became chief of psychology somewhere along the way as well. So it's evolved over the 20 something years, more and more administrative and teaching, and less sitting down with
Mm-hmm.
patients and working with them, although I never have given that up and I never will. I like to have a small pool of people to work with.
That's nice. So I know you specialize in CBT. So can you describe what CBT is and why you chose to specialize in it?
Sure, yeah. CBT is a type of talk therapy called cognitive behavioral therapy. So it's a well researched form of talk therapy that is a little different than what the stereotypes of talk therapy are about. It's not lying on a couch. It's not talking about your childhood or your mother or your dreams. It's a very practical, skills based type of psychotherapy that teaches people practical skills to look at the way they think about things and look at their patterns of behavior. That's the C is cognitive. Cognitive is all about our thoughts.
Mm.
And B, the behaviors is all about the patterns we create in our lives.
Okay.
CBT says, well, maybe if someone's struggling with depression or anxiety or anger or something else, maybe it has to do with how they think about things and what they're doing. And
Mm.
if we can teach them to rethink things in different ways and try doing things differently, they can feel much better. So it's very practical. Patients like it because it feels like a class. They get homework assignments. We look at forms together, and it's teaching and learning so that by the end of treatment, people have a set of skills that they can then use on their own. They don't have to rely on people like me, and they
Mm.
do pretty good. And the research has shown it can be as for a lot of things as effective as medications. It
Mm.
just it's just a little bit more work than taking a pill because you have to sit down and practice. So I
Mm.
love it because you help people who may have, for whatever sorts of reasons, lost out on some opportunities to learn certain skills because of their life circumstances, and you teach them some stuff, and they start feeling better, and they start realizing they can have a different life than they've had, and it's very rewarding. And
Okay.
it's meant to be short term and practical, and again, it's not winging it. It's based on now 50, 60 years of research studies that have shown that it can be very powerful.
Mm. What are some other type of therapies that people use?
Well, in the category of evidence-based psychotherapies, the other big ones these days, there's one called DBT,
Mm.
which stands for dialectical behavior therapy, which is a treatment that's it's people think of it like another wave of CBT,
Mm.
where CBT was very change based. You change your thoughts, you change your behaviors, you can change the way you feel.
Mm.
DBT, dialectical behavior therapy, still has a change component, but it's ushered in and uses also more Eastern philosophy around mindfulness and acceptance based
Mm.
approaches. So it balances in what we call these sort of dialectical dilemmas of two separate things that we're trying to balance, like something like that get into sort of dilemmas, if you will, where they don't seem to be compatible but they can coexist. Things like accepting things as they are and striving for change. Yeah, CBT says we can do both. We can strive for change, and sometimes we also need to accept things like, say, chronic pain or the loss of a loved one who's passed away. You can't change any of those facts. You have to accept pain. For some people, it's going to be a part of their lives, and they can still choose to act in certain ways despite the pain and because of the pain.
Mm.
So there's DBT that does that. And it was initially created for people with a disorder called borderline personality disorder, which is a difficult to treat personality disorder that has a lot of ups and downs and impulsivity and emotions that get out of whack.
Okay.
But now it's been applied to other things. And
Mm.
then there's a third big one called ACT, which is a very popular treatment approach now, which stands for acceptance and commitment therapy, which
Oh.
kind of like CBT, but it expands a little bit more like DBT in a variety of processes that are connected with accepting things,
Mm.
and that, as the name implies, a set of processes that enhance people's ability to commit to the things that are really important to them, the big values that we all have.
Mm.
How do we? It helps people line up their actions with their values and commit to those to create what they call psychological flexibility, which is a marker for well-being and mental health.
Oh, okay. What advice would you give to people who are interested in specializing in psychology but aren't sure which path to take?
Well, I think part of it is depends where you are in your training. If it's early on, like high school or college, you've got time. So I think it's important to to fully explore what it's about and what its allied fields are about. Like very close to clinical psychology are fields like social work, clinical social work. master's in mental health
Mm.
counseling. Some people go into medicine, get an MD, and then move into psychiatry, which
Oh.
is so there's lots of pathways and careers that that can get you to working with people in the field of mental health. Psychology is just one of them. So it's early on. It's nice to be able to sort of explore like you would anything in life, like figure out what resonates with you, what excites you.
Mm.
None of these paths are easy in terms of the training and the commitment. As we said, it was like, call it 12 years from when you finish high school to seeing the finish line ish, 10 to 12 years. So it's a decade and change of your life. You'll be dedicated. Even if you say, well, I could do medicine, but medicine is 4 years for an MD. And then you have to get that's just your medical degree. And then to go and say you wanted to go into psychiatry, that's another 4 years to get your residency in psychiatry. And then if you wanted to specialize in, say, child and adolescent psychiatry, that's another 2 years. So you're up at 10 years in through medicine, right?
Yeah.
So it's good to explore. And for me, it's like figure out um, what really, what gets you excited, right? There's a part of it that you have to do knowing it's hard work that you can see yourself loving, right? And also being honest with yourself about like where your strengths and where your relative weaknesses are. And that helps narrow things down. Some people, um, their math isn't their thing. And some, so or science isn't their thing, but the arts is their thing. So there's versions of pathways that don't require as heavy emphasis on the maths and sciences, but instead the arts. Right? Like a bachelor of arts in psychology is different than a bachelor of science in psychology. There's different requirements to get the degree, and
Mm.
so it's also like figuring out where your strengths and weaknesses are, what courses appeal to you. Okay?
That makes
So
sense.
there's a variety of questions you can ask yourself later as you get down the path. It usually becomes clear as you walk the path.
Mm.
Right? Early on, there's numerous paths, and all are reasonable. Just depends on your own life circumstances and background and interests.
Mm.
It's hard work. Any mental health field is hard work because you're by definition working with people who are really struggling with their mental health. So you also have to um, recognize that that'll be your week.
Mm.
You have the thrills of trying to roll up your sleeves and help people who are struggling feel better. But you also have the challenge of knowing your days often will be structured and filled hour after hour with people who are really in great despair and great emotional pain. And
Yeah.
for some people, that's very hard to let go of and push aside. It takes a toll on therapists as well. If you hear story after story and people struggling after struggling. So you also have to take a good, honest look at yourself and know the field. Ask people like you're doing with me questions about are they happy? Would they go back and change anything? Those sorts of questions as well. And I'm sure in high school there's guidance counselors, and in college there's like career learning centers to help it along the way.
I was just gonna ask you, like, how do you balance the emotional demands of your work, like more in the past, with your own mental well-being?
Yeah, when I was in the clinic full time for 4 years, it was even my postdoc before I moved in between to that research year. In my postdoc for the 2 years in Philadelphia, it was pretty heavy with clinical work and then a little bit of research. And so I think it becomes really important to create opportunities to unload some of that. And some ways to do it are to make sure you have a good peer group of people that you can meet and sort of talk through difficult or challenging moments or cases. And most centers have built into the week team meetings where the providers, therapists get together and they can meet and sort of support one another in the work they're doing. It's also like having a good support network outside of the field and having like a cadence to the week where you're taking care of yourself, like all the basics you would have someone else do with good sleep schedule, good diet, good exercise, some social support, some social outing, so that you're leading a balanced life, and that other side of your life helps to manage the stuff that gets tougher.
Mm, okay. Are there any general strategies you can give to people to maintain and improve their mental health? Like general strategies?
It's a little bit building off what we just said, I think, right? I guess maybe the first thing to recognize is I think it's better these days, but mental health is as important as medical health,
Mm,
right? And unfortunately, there's some places still a stigma around mental health. Like somehow, if you're struggling with your mental health, it says something negative about you,
mm,
like you're weak or you're crazy, or people come up with all of these mistaken, unfortunate beliefs about, because you can't see it as quickly as you can someone with like a cast or crutches or something. So they believe because it's invisible to a lot of people, it somehow means person's defective. And that's just not true. So the first thing is to recognize that this is normal. The numbers, if you take the research and look at how many people will suffer from anxiety or depression in a year, it's a huge portion of our population. So accepting that and recognizing that's not your fault, doesn't say anything bad about you. It'd be the same thing like if you had a medical condition, if you became diabetic, or if you got COVID or something. We're just all vulnerable to particular things at certain times. So accepting and embracing that, and then becoming aware of when it's also having a disorder is different than just having a temporary lapse. Like people can feel sad or feel down without necessarily being in a diagnosable depression, right? Just like people will get anxious and stressed, and that doesn't mean you have a disorder to feel anxious or stressed, because life is anxiety provoking and stressful sometimes. So there's also a normal range to experiencing all the anger, guilt, depression, sadness, or anxiety. They're all normal emotions. It's only if they hit a particular point, and you know it when it hits that point. We all have our gauge that'll tell us this either feels more intense than I'm used to, or it's lasting a lot longer than what would be a normal little episode, or it's in particular it's stopping me from being able to function in some way, like at school or in my home responsibilities, or if I have a job, I'm not functioning as well in my job, or my social relationships are changing, like people are commenting or on that I'm not the same, or that I don't want to go out and I'm not doing as much. If those things start to happen, chances are it's worth getting some
mm,
help. And then it's a matter of just reaching out, and there's lots of resources online that connect people with help. And in between are things like self-help books or apps or computer websites
mm,
that people can sign up for or purchase, and it guides them through a lot of steps that can help them get back on track. And a lot of them, again, I'm in the CBT field. A lot of them have people look at first about what do they think their current weeks look like when they're not feeling like they would like to be feeling, and then based on what you might monitor yourself for a week or two and see what activities, what your general couple of weeks looks like. And
mm,
then the idea would be to start thinking about, well, if I keep going the way I'm going, I'll probably keep feeling the way I'm feeling. So behaviorally, what could I change that might give me a shot at feeling better? And usually that requires programming into your week activities that give you either a sense of accomplishment or a sense of joy or pleasure. And people who don't feel good usually are missing those things. So we start telling people, bring more of those things back in your life, either that you used to do or that you could do more of or that you've never done. And a lot of people start to feel better.
It's really cool.
Within that, certainly exercise of some form has robust effects on people's mood and well-being, right? And it doesn't have to be join a gym or join a professional team. It can be just the simple act of moving more, getting out, walking, stretching, yoga on YouTube, whatever it is, just some form of exercise typically has robust mental health benefits and costs nothing, right? And then the other things I hinted at, sleep is super important, making sure your sleep cycle is steady or getting a good night's sleep, solid quality sleep, and eating an appropriate diet that's healthy. Those are like things that are transcend mental health, but they're an important part of mental health, right? No one in any health field that I would know would discourage exercise, eating, and sleeping
Yeah,
as core pieces of a foundation for better health and mental health. Right?
that's true. Yeah. So throughout your career, what are some skills that you find most valuable and essential for you? And what skills do you think are essential for an aspiring psychologist to have?
For you mean for your mental health?
No, like for your career now.
Oh, for your career now. Yeah. I think let me think. Well, one would certainly be organizational, because to navigate through college and then graduate school, doing your SATs or other achievement tests, and then to get into graduate school, there's another set of tests called the GREs, the graduate requisite examinations, or if you go into medicine, there are the MCATs. So there's and there's classes to take and essays to write and labs to attend and 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 papers and quizzes. And so um, when you get to college, all the structure of high school kind of goes away, especially if you leave home and go away and stay in the dorms. It's on you. There's
Yeah.
no one there to check up on you, and there's no one there to crack the whip. You'll go or you won't go. You'll do or you won't do, and your academic success will reflect that, right? So it requires a sense of organization early on, to that you take on, and high school is a great place to learn it. Early college is a great place to implement it. Like, what do I need to do as a young adult to organize my life that sets me up for success? It's, that leads to the next one I'd say, which is it doesn't hurt to have at least some rough vision of, again, generally, here's where it can change, but here's where I want to point my compass towards. Here's what I'm thinking. What excites me? What am I passionate about? Is it, is it business? Is it arts? Is it science? Is it economics? Is it the law? And then start to dabble early and see, well, does the experience line up with that as I start to do it and get career advice from various people?
Okay.
And then the third one, if I could sneak it in, is just I'd say persistence is really important. You will hit road bumps.
Yeah.
Inevitably, you'll fail a test or you'll fail an essay or you'll find one class really challenging. Uh, you might not, you'll do some sort of interview and you might not get the job or the experience. And um, it's really important to commit and to persist in the face of adversity, because most pathways to success are not nice, smooth, linear pathways. They are uh, sawtooth. They're up and down, and it
Yeah.
goes for anything. If you're anything you're working on, that you would name any skill to build is often jagged.
Yeah.
Right? So don't get discouraged.
Okay. Um, what was I gonna ask? Oh yeah, what do you love about psychology and why would you recommend it to someone interested in exploring the healthcare field?
I mean, again, I'm a clinician at heart. I love uh, helping people. And I just shifted from actually sitting in the room helping people one on one, which I still do a little bit, to now helping trainees understand how to learn the treatments that they can then do to help people, right? So now I'm teaching therapists to do CBT so that they can go off and help people. So the idea of uh, being present in someone's life when you can create change is really important to me. It's one of my, I call it the broadest sense of charity, like giving to people who are less fortunate. Either sometimes it's a money donation, but more often to me, it's about helping people out when they need a hand. Okay? So I find it very rewarding personally to when I have a person that we're done and we're saying goodbye because they feel better. They came in feeling bad, they leave feeling better. That's a really good feeling,
Yeah.
right? Or a trainee that comes in and knew nothing about CBT and then they finished their year and they can go off in the world and do CBT and then 10 years later they write me a note or they send me a copy of their book they've written on CBT or something. That's really cool.
Yeah.
Right?
Cool.
And and so that's what I really think about psychology. And what was the second part of your question? I'm sorry.
Um, why would you recommend it to someone interested in exploring the healthcare field?
Yeah, it's psychology and psychiatry are needed. First of all, there's so much mental health uh, issues in our country and in the world today, and again, it's had relatively less attention because of the stigma attached to it historically. And if it's psychology, at least in most states, we're not prescribing medications. So your only tool you've got is your brain. And the fun part, and the challenging part is to try to take a person that's struggling and using just your words
Mm.
and some ideas that you have, like a scientist, you create a, a model that you think explains why the person is struggling, and then you test it out scientifically. You make suggestions on things, skills they can learn that you think will help. And based on what's happening, you adjust your model.
Mm.
And so it requires like figuring out a puzzle.
Mm.
Each person with different backgrounds and circumstances and ages and symptoms, and each one's a new challenge to come in and really test yourself on, like how do you figure out what's going on with them using just your words. We don't have labs, we don't have blood tests, we don't have x-rays. And then how do you create a plan with a person to get a different life using just talking it through with them, but in a very pointed way to learn some skill. So it's the challenge of it and the joy in it is really rewarding as well because it makes you think all the time.
Yeah. Well, thank you so much for the interview.
Yeah, thank you for focusing on the topic.